So today we will learn about nursing process. So purpose to identify a client health status and actual or potential healthcare problems or needs. Okay, then to establish plans to meet the identified needs and to deliver the specific nursing intervention to meet those needs. So what is the purpose of nursing process? It is to identify the client's health status. What is the health condition of the patient and what are the actual problem the patient is facing and what could be the problem the patient might face in the later stage, and what are his or her needs at present and for the past or and as well as for the future. Then to establish plans to meet the identified needs and to deliver the specific nursing intervention to meet those needs. So the definition of nursing process, it is the systematic rational method of planning and providing the nursing care. So it is the systematic means you are applying the steps like assessment, nursing diagnosis, planning, intervention, as well as evaluation. So that is why it is a systematic rational method. Rational method means whatever care you're providing, there will be a perfect reason for that. Okay, now suppose if the patient is having increased temperature, okay, he's feverish, he's having fever, so you're providing the tepid sponge or you're providing a blanket for him, okay, because he might get shivering. So there is a rational, there is a reason, there is a rational, okay, for every care you're providing. So systematic rational method of planning and providing the nursing care, it is the, and then check the next point. The nursing process is cyclical, that is, its components follow a logical sequence, but more than one components may be involved at one time. So it is the cyclical. Okay, so after evaluation, after the last step, if the care is not effective by evaluation, you will come to know whether your care is effective or not. So suppose if it is not effective, you will provide the care again. So you will continue or you will take the different step again. Okay, same way like assessment, diagnosis, again you will do it. Okay, until the patient gets cured. Then, what are the different components of nursing process? You have assessment, nursing diagnosis, planning, implementing, and evaluating. So these are the steps you have to remember. Total how many steps? There are total 5 steps. Assessment, nursing diagnosis, planning, implementing, and evaluating. That is why yesterday I had sent one video for you saying add pi. Okay, add pi you should remember. So that time it'll be easier for you for the exam or anywhere if you get a chance to write the nursing process. Then what are the different characteristics? It is dynamic, it is client centered, it is planned, then interpersonal and collaborative, universally applicable, and it can focus on problems and strength. Interpersonal and collaborative means, interpersonal means within the nursing. Then collaborative means the nurses will be collaborating with other team members like doctors, radiologist, dietitian, nutritionist, physiotherapists, etc., pharmacist. And universally applicable, it can be applicable to all the cases. Then it is open and flexible. Okay, you can change it. Okay, according to the priority, you can change it. Then it is humanistic and individualized. It is cyclical, it is cyclical, then outcome focused. Okay, because the last step is evaluation, so always it is outcome focused. After assessment, you will have a goal, you will write a goal, okay, outcome, then emphasizes feedback and validation. Then what are the benefits? Continuity of care, prevention of duplication, individualized care, standards of care, increased client participation and collaboration of care. Okay, steps of nursing process. Now, these are the nursing process. See, it is cyclical. So after the assessment, you will do the diagnosis. Then there is a planning. Then there is a intervention. After planning, there is intervention and evaluation. In simple words, if I have to tell you, assessment means you are finding out what are the problems the patient is facing. After understanding what are the patient's problem, you will come to a conclusion. Okay, that the patient is having fever or the patient is having self care deficit. That means he is not able to do his provide the care by himself, he needs some help. Then after knowing the diagnosis, according to that you will plan what are the care you're supposed to give for the patient. Okay, different points like 5 to 6 points you have to um, plan. Okay, then implementing means whatever you have planned you are putting into action, you are implementing it. After implementing you are evaluating whether the care was effective or not. Okay, that is evaluation. Okay, so first we will learn about assessment. What is this assessment? Assessing is a systematic and continuous collection, organization, validation, and documentation of the data as compared to what it is standard norm. So it is a continuous process. All the phases of nursing process depends on the accurate and complete collection of the data. What are the purposes of assessment? So you have different assessment like to establish the database, to identify the health promoting behaviors, to identify the actual or potential health problems. Okay, then what are the different types of assessment? We have the initial assessment, the problem focused assessment, emergency assessment, and time lapsed assessment. So, initial assessment means it is done within the specified time after admission to the hospital. Okay, within the specified time after admission, immediately after admission of the patient, you will be assessing. So, what are the current problems the patient is facing? He will explain to you. So this is to establish a complete database for there will be a this is a database for problem identification, reference, and future comparison. So for example, the admission assessment. On admission, whatever complaints the patient is telling, that is the initial assessment. So next is regarding the problem focused assessment. That is the ongoing process integrated with nursing care. So after the patient gets admitted to the hospital, what are the problems he is facing, what are the problems he is experiencing, he will be explaining to you. That is the problem focused assessment. So um, to determine the status of the specific problem identified in an earlier assessment. So assessment of the client's fluid intake and urinary output in an ICU. Okay, what are like fluid intake, how much fluid he's taking, or what is his urinary output? You're assessing that. That is an ongoing assessment. That is a problem focused assessment. Next is regarding the emergency assessment during any physiologic or psychological crisis of the client. So emergency on the spot in case the patient is having any physiologic or psychological crisis, any serious thing happens, that time whatever assessment you are doing, that is the emergency assessment. This is to identify the threatening problem and to identify new or overlooked problem. That is rapid assessment of person's airway and breathing status and circulation during a cardiac arrest. So cardiac arrest is the emergency situation. So that time, during this time, whatever you are assessing, okay, like especially the patient will have breathlessness as well as any abnormality in the heart. Okay, so these are the emergency assessment. Next is regarding time lapsed reassessment. So several months after the initial assessment, that is to compare the client's current status to the baseline data. That means after providing the care, after so many days, okay, you are reassessing from you are comparing the first one. Okay, initial assessment. Okay, you're comparing the initial assessment is the baseline data, isn't it? So to compare the client's current status to the baseline data previously obtained. So example, reassessment of the client's functional health pattern in a home care or outpatient setting or in a hospital at shift change. Reassessment of the client's functional health pattern in a home care or outpatient setting. Okay, after discharge. Okay, person after going home care setting or outpatient setting, you are assessing the patient to provide to assess any changes. So that's about the um, types of the assessment. So from tomorrow we will learn about the steps of assessment. So far we learned about the diagnosis of, I mean, the definition of nursing process. What are the benefits of nursing process? Then what are the different components? What are the different components? There are 5 components. That is the nurse assessment, you have the diagnosis, you have planning, intervention, and evaluation. So today we learned about detail about the assessment. Okay, so it's not complete, you have still more to learn. You have different steps to learn, and after that we will go for the nursing diagnosis. So today whatever we have learned, if you have any doubts, please ask me.